Married to Medicine, new show coming to Bravo. I mean, first of all, psychiatrist, how are you going to balance that with your daily life? I mean, and you're married to a doctor. How are you going to marry the, balance the show?
Structure. It's literally structure. Just going through it on a day-to-day basis. Like, okay, 7:45, we're out of the house. And excuse me. It's just structure, and like Imani said, delegating. You know, just really trying to balance. It's a balancing act on a day-to-day basis.
It's responsibility. Ask for help. You can't do it by yourself. I was having panic attacks because I needed.
Some of us have to learn.
Right. Well, I would say to myself, like, if I didn't have to sleep or eat, like, my life would be amazing. And at that point, I was like, you know what?
We need some help.
We need some help. I'm gonna tap on Instacart and have them deliver some groceries because there's no need for me to have a panic attack in my bathroom because I feel like I need to do it all. Like, who am I impressing?
Yeah, I feel like it's okay to pull back, and I think that's something also that's very hard to want to grasp as a woman, especially as Black women. We always are like, no, we need to be strong.
We can do it.
We need to do this. And
you want to be that strong Black woman. You want to balance it all. You want to take care of your husband, take care of your, work and your kids. And then before you know it, you're like, have I been taking care of myself? Right. When have I stopped to say, okay, Shanique, just breathe for 5 minutes? And that's so important to understand and remember that. Just breathe,
Just breathe and massages.
Ooh.
Yes.
Gotta order a few of those.
Oh, yeah.
Hello, Soothe.
Hello,
See you in 2 hours.
Right, exactly.
Well, maybe on the app.
And I think it's so important that you guys both touched on self-care, which I think is so important.
Absolutely.
And recently, Taraji really touched on even mental health, which I think self-care can definitely go into that. As being someone who's a psychiatrist, and you as well.
Yeah.
What are your thoughts on this within our community, especially with men and women all struggling with to even accept the first step?
Well, we as African Americans, we have in a lot of cases, we have oftentimes been just the kind of people who have had to assume the burdens of others, whether it be ourselves, whether it be our family, whether it be like, if I'll just do it, then it'll just be better.
Yeah.
Right, but we have to learn that we don't have to put ourselves in that position anymore. It's okay to ask for help. It's okay to say no. It is like no is a sentence. Like it's not a word.
Period.
But I think also it's the stigma of like going to see a psychiatrist, and I'm sure you've seen that a lot. Like in our community, we need to realize it's okay. It's okay to go and talk to someone other than friends and family because sometimes we're not even going to listen. We're going to ask them, but we won't listen to them anyways. So ask for help and go get the help and just normalize it. I think you'd speak for that.
Exactly.
As well.
It's very important I can speak for myself and also I think for some of my patients that I've had that when you hear your troubles like come outside of your mouth, it's so freeing and you feel like burdens have been lifted off of your shoulders. Exactly. And even if the other person isn't saying anything, just knowing that there's someone who is willing to just open up and listen that you feel comfortable with, a lot of times makes all the difference. Yeah.
I love that. I love so much of what you guys both said. But I mean, even on a lighter note, this is reality. We're about to be some drama. I know we're talking about the self-care, but I want to know a little bit about the drama. You guys seem nice and civil right now. But what happens when the cameras are on? What can you give me a little tidbit of?
There was some drama. You have all these group of women together, strong women that has their own passionate women, and we have our own opinion. You put like 6 of us together, there's going to be some room for drama, and there definitely was.
Exactly, and when you're dealing with friends and you're so close and you're physically close to each other as often as we had to be, and and we worked during all of that, like a full day of work, go home, put on makeup, change, and then you're at an event or you're out to dinner or it's
straight from work.
Oh, absolutely right. It's like like I would be like, okay, well, I'm going to wear this tonight when I go link up with Shanique or when I go link up with any of the other ladies. You're going to get frustrated. You're going to get irritated. You're like, like my feet hurt. I just want to go back to my bed.
But you're exhausted. You're like, everybody step away, okay? And be careful of what you say tonight while we're at dinner.
Right, because if you breathe wrong, I'm going to completely go nuclear.
The day has already been up to here.
Yeah. Right.
I don't need it.
Right,
exactly. You better smile for the rest of the dinner, okay?
So I hope the viewers are able to realize that although there definitely has been drama in Atlanta, there's very much drama in LA. It's not going to be, like we like to keep things civil and we like to keep things stable, but when you really get to kind of like take a really closer look at our relationship and our friendships, you'll understand why the drama that ensued on the show, why it occurred.
I mean, Married to Medicine LA definitely brought its own, like, you know, take on things as far as the, you know, the Atlanta show. We're two different, you know, similar franchise, but different entities, you know, but our friendship is so different, and our, you know, experiences are different, you know, our marriages and what we're going through. So we're hoping that the viewers will be able to connect with us and, you know, maybe learn a thing or two from us.
Yes, I love that. Well, thank you guys so much for speaking with us.
Hi guys, it's Shanique Drummond from Married to Medicine LA.
And this is Dr. Imani Walker of Married to Medicine LA.
And you're watching FabTV. Tune in on March 10th for the premiere
of Married to Medicine Los Angeles on
Yay!
Bravo. And also BravoTV.com.
BravoTV.com. Check us out, guys.